Inclusion Health webinar. My name is Chris Helfelt from Philly, and we are running the production today. A quick note, now that we are starting the broadcast, please click the picture frame underneath the TV that says click here. This will open up a new YouTube tab so you can ask questions and make comments in the chat throughout the broadcast. With that being said, I'm going to turn it over to Susan Dorfman to kick off this virtual event. Thank you.
Good morning and good afternoon to all of today's attendees. My name is Dr. Susan Dorfman, and it's an honor for me to welcome all of you to today's critically important panel focused on diversity, equity, and inclusion in health. There has never been a more critical time, not only to have this discussion, but more so for us to take action. And with that, let me introduce our moderator for today, CMI's very own Chief Operating Officer, Eugene Lee, and let's begin.
Welcome, everybody. Thank you so much, Susan. As Susan said, I'm Eugene Lee. I will be the moderator for this. As lucky for me, as a moderator, I get to ask the questions, and the panelists have to answer the questions. So they're the much smarter ones in this virtual room than I am. So I'm really excited to introduce this panel for everybody here. And so today, we're going to be introducing and speaking to Patrick Wisnom from WPP as a global client lead, Greg Edwards, the President and Chief Operating Officer of UniWorld, Henry Gomez, Vice President Strategic Planning at Zubi, Iris Yim, Multicultural Strategist from Sparkle Insights, and Rebecca Rosen, Senior Research Analyst from Zubi. Again, if you haven't clicked the below area, make sure you do so you can ask questions throughout this session. And we'll have a section towards the end to do questions and answers as well to make sure we answer any kind of questions that you have. So with that, we're going to dive right in. We want to make sure we get to the meat of the content and cover off on all the topics that we wanted to cover off onto you today. We're actually going to start by covering off some of the statistics. The statistics only tell a top-level story. When you look at these three groups, and these are the three groups that we're going to be covering today, this thought process applies to a lot of the other diverse groups out there, but for right now, we're going to focus on the Hispanics, the Hispanic community, the Black community, and the Asian community. And when you look at each one of these communities, there are characteristics that we wanted to kind of call out for you. From the Hispanic community side, the market size at 60 million in the US is one of the largest communities out there right now that we wanted to make sure we discussed today. The second largest group is the Black community, and within that, you'll hear a little bit about how in that Black community there is a dynamic of a diversity of thought within that Black community that we're going to make sure that we address. One of the fastest growing and the third largest community that we're talking about here is the Asian community. And as that community grows, they're bringing a significant amount of economic power with that growth too. So we're really excited to talk about these three groups, and we're going to dive right in doing so. So we can certainly show stats for a long time and a lot of information on there. But like I said, there are some deep dynamics within each audience that the stats don't reflect. So we're going to start by covering off on each one of those three categories and doing a little bit of a deeper dive into those characteristics beyond the stats. So let's explore that, and we're going to, as the title of the panel suggests, it's going to be around this healthcare dynamic for each one of these communities. So we're actually going to start with the Hispanic and Latinx community. So I'll actually ask this to go to Henry and to Rebecca.
So thanks, Eugene. Real quick, when we're talking about Hispanics at a high level, a few things you need to keep in mind is, as you saw with the numbers, it's a market that does have scale. 60 million people we're rapidly approaching a period of time where it's going to be 20% of the U.S. population. Along with that is the immense buying power. We're seeing a socioeconomic success story with Hispanics, particularly over the last 10 or 15 years, that make them an audience that you can't really ignore. A longer lifetime value, this is really the result of you might have seen briefly on the previous slide the median age. The median age for Hispanics is more than 10 years younger in the United States than for non-Hispanics. So think about a youthful audience that perhaps when you're thinking about pharmaceuticals, it doesn't seem to be a higher priority depending on the pharmaceutical. But as we get along, these are people that are going to be customers for a long time when we're marketing to them. And lastly, on this side is talking about culture being very important to Hispanics. 83% of Hispanics report wanting to maintain a strong cultural connection to their Hispanic culture of origin. Now, on the right-hand side, you see 3 traits or characteristics that we thought we'd highlight today for the discussion that have a lot to do or will influence healthcare decisions. The first thing is fatalism. And what is fatalism? It's really a belief that que será, será. What will be, will be. I don't control a lot of the big things that happen in my life. And this is kind of a default mentality with a lot of Hispanics that comes from a very religious history and background. There's some superstition there, but it affects the way they see healthcare. I like to say sometimes when it comes to nutrition, for example, they'll say, I know I shouldn't eat this Whopper, but perhaps if I don't, I'm not going to enjoy it and I could get hit by a bus because there's so much things outside my control and I'm not going to die happy, right? So it's important to keep that in mind as we're dealing with Hispanics and talking to them about health outcomes, that they do control certain aspects of their health outcomes. So we want to keep that in mind. Optimism is also something that's very characteristic of Hispanics. They always see the pot of gold at the end of the rainbow, if you will. This is largely an immigrant culture, right? So, and it's an immigrant trait. The Hispanic culture in the U.S. is very different than, say, a Latin American culture. This is a self-selecting group that decided to come to the United States in pursuit of a better life, and therefore they're looking for validation for that. And we see that actually passed down through the generations. And the last thing that's really important is familism, or how interdependent Hispanics are. When they it's not just about nuclear family, it's also about extended family, and family ends up weighing a lot in decisions, and that extends into health care as well. I know that Rebecca had a couple of things she wanted to add here.
Yeah, so these cultural values that Henry spoke to are things that connect the Hispanic community, but there's a lot of diversity within the group as well. So when we talk about Hispanics, it's an ethnicity, not a race. And so there are Hispanics of every race that can certainly affect their experience. It can affect things like disease incidents. Race can even affect different kinds of dermatological concerns that people might have. And then there's also a difference in country of origin. And so that not only changes how somebody might identify, but it can also affect disease incidents. For example, those of Mexican descent have higher incidence of diabetes than other Hispanic groups. And while Hispanics as a whole have a lower incidence of asthma, when you actually look at those of Puerto Rican descent, they're 1.7 times as likely to have asthma than non-Hispanic whites. So they actually have very high rates of it. And so those disease incidences not only change the specific group you might be speaking to, but the DMAs that they're in. We see regional differences in country of origin and race, and so that can affect things like a media plan or how you target those groups.
Awesome. I got distracted by thinking about Whoppers, and then you have to leave the house in order to have a Whopper these days, and we can't do that right now. So I got distracted by that, but thank you so much, Henry and Rebecca. So I think we're going to now move to a conversation around the Black community. So Greg, if you wouldn't mind.
All right. Thank you. So when we're talking about this conversation relative to Black consumers, we have to first start with the understanding that we're talking about one of the longest standing multicultural groups in America, from the sense of the time of most of them being brought here. And then we also think about the fact that they've actually evolved their proposition over the years, and immensely evolved their proposition. So it's really a market with scale, and that's really important to understand, is that we continually see an evolution and expansion of the importance of Black consumers in the United States economy, and the impact that they have overall on brands and marketing, and quite frankly, the way in which companies go to market. Also, because of this idea of them actually, the fact of them actually being younger, they actually present for you a longer lifetime value over time. And so you think about it longer in the sense that it gives you a chance to be engaged with them a much longer time in prevention, in medical prevention, and also in areas of actually going in and helping with actual solutions for them. But those relationships can be longer, and they can actually be more powerful. The next thing to be considerate of is the idea of the immense buying power of Black people in this country. While economically Black people do have a disadvantage in many ways, they continue to represent an incredible amount of discretionary income and opportunity for connection for most brands. And more importantly, because of some of the lifestyle things that have impacted them, they tend to be more susceptible to the things that really work most in this category. So it's important to understand that as you think about how to connect with Black consumers. And the last piece, which is really important, is this idea of connection to culture. I don't think anyone would dispute the role that Black people play in American culture, but more importantly, in understanding how their culture now, to a certain degree, is beyond just what's happening in America. It's shaping culture around the world. And that's been the case for many years. But in the time that we're in now, this crisis of both the economic downturn, the pandemic, and the untimely death of George Floyd, we see these things coming together in such a way that it creates a more significant impact for them with culture. Three takeaways is to understand that, this is an extremely resilient consumer group, right? They've endured 400 years of an America that's not always been the best representation for them or the best opportunity, but they have this fatalism that's really interesting, because their take on fatalism is this idea that, things happen and you just adjust. And it does impact the way they think about their health, and to a certain degree, to a negative degree, because it allows them to say that, well, things just happen. And so there's a tremendous opportunity for people in this category to really hone in on understanding, to understand why things occur, simply they just don't occur. And then always taking consideration that there's a conversation constantly now around racial justice and representation that impacts everything from the physicians they want to see, to the hospitals they want to go to the companies that produce the products that they actually are connected to. If you're a pharma company, you've got to think about the fact that Black people really want to understand your origin. They want to understand not only how you're doing business, how you've been doing business, but how you think about doing business going forward in a country that's now seeing transformational change in regard to racial justice and representation.
And Greg, when we were preparing for this panel, you also described the Black community as having a diversity in thought. Would you mind sharing a little bit more about that?
Sure. A lot of times people have a takeaway that Black people are a monolithic group of individuals, right? And I'll give you a story that'll help you kind of see how they're not monolithic. In fact, during the recent presidential election in the United States, almost 20% of Black people voted for Donald Trump. And, when you think about everything that administration sort of stood for, you say, well, that can't be, because, these are things that stood against who they were. But Black people are really divergent in their thinking and in regard to how they think and how they can be processed and understand. So you have to understand that they think differently. They have diverse perspectives. They come from, a diaspora of countries and groups and understanding. And so you not only have the concept of Black people being African Americans, people who may have been part of the enslaved group that was brought here, but you have other Black people who have come to this country also to be put into that group of Black people. So a ton of different thinking, a ton of different perspectives. Religion is really important, but then there's also this group that looks now at a more modern and technology world. And so you've got a lot of different thinking, a lot of diversity there, and that diversity is what gives them this incredible buying power and clout, because you find them in every segment, in every category in the world, making purchases, making decisions, and driving growth opportunities for companies because of that diversity and that thought process.
Awesome. Thank you, Greg. So next we'll cover off on the Asian communities, and I'll have Iris share some of that.
All right. Well, thank you, Eugene. So as Eugene mentioned earlier, Asian Americans have the fastest growth rate, 84% growth since 2000. And the primary driver of that growth is immigration. Asian Americans, they move from more than a dozen countries in Asia. So there's a great deal of diversity within this group. And the 5 largest groups are Chinese, Indian, Filipino, Korean, and Vietnamese. They do have higher than average household income. It's more than 40% higher than the national average. But I also want to caution that it is also a group with higher within group inequity. The top 10% highest earners make more than 10% of the income of the bottom 10%, which is higher than the national average. So we also need to keep that in mind. Another characteristic is Asian Americans, they are at the forefront of market trends. Whatever is popular among Asian Americans is usually a pretty good indicator of the next big thing. Korean beauty is one example. What I have here is video games. Esports has been on the rise in the US. It's a new frontier for marketers, and the pandemic only accelerates this trend. But video game as a global industry has been dominated by Asia for many years. So it's not surprising that it's very popular among Asian Americans, and they over-index on game ownership of game consoles and virtual reality headsets. And the fourth characteristic is they are digitally connected, very tech-savvy. They over-index on high-speed internet connection, ownership of smartphones, computers, a host of smart devices. What I have on the right is a few overarching cultural values. Collectivism speaks about the emphasis on cooperation and interdependence. What that means is that the greater good of the community takes priority over personal freedom. And the fact that some East Asian countries have the pandemic under better control, it's because people are more tolerant of strict virus containment measures. And the second one, pragmatism, it's about the different ways of thinking and doing things between the East and the West, contrary to the way of doing things in Western culture in many parts of Asia, and particularly in China. It's about a way of doing things. It's about flexibility, improvisation, and taking whatever it needs to address a situation or getting results. And the third one, family, and the definition of family, usually includes extended family. In this regard, it's very similar to Hispanics, and it's not uncommon to see multiple generations within the household, with the same household. In fact, grandparents are usually the primary provider of childcare. Parents will make great sacrifices for children, but they are also very demanding. They often have great influence on their children's career choices and education. And
I can attest to that. Absolutely. As an American-born Taiwanese, the familial connection is absolutely true. I have first-hand experience with that and the involvement and the importance of family within my family too. So, for what it's worth, for the people watching, as you have a data point of 1 here that confirms that. So we talked a lot around the statistics, the different characteristics within each one of these communities, and we wanted to talk also about the health considerations within there. So we've actually looked across different kinds of conditions and the impacts that those conditions have to each one of these communities. So I think Greg, you were going to try to cover off on what we've uncovered here.
Yeah, so there are a lot of key norms here that become abnormal if you think about it from a total market perspective, right? So when you bring these 3 groups together, you're looking at this contingency of lower life expectancy, diabetes rates that are unimaginable in a total market scenario, and then the construct of high blood pressure, bone density issues, and then dementia and along with cancer. Now, ironically, you have to think about the fact that wellness is not just a construct of if I feel good today, then I feel good tomorrow. It's also the practice of things you do today that make you feel good tomorrow. And these groups are under an incredible amount of pressure and stress that also leads into unhealthier lifestyles. So when you look at that, while these are challenges for everyone in general, the combination of bad nutrition, obesity, and a bad bill of health come together in this sort of perfectly horrible storm to create more obstacles and challenges for these groups versus total market consumers or general market or white consumers on a daily basis. And they tend to stand out in some of the most the risky areas out there. Heart disease, the idea of dietary regimen, and then this concept of cancer. So these groups come together to form some tremendously large opportunities for all of the bad reasons. It's a combination of the bad reasons, Eugene. Their lifetime, their life experiences, all the things they go through lead into some practices and some health issues that they face long term.
Yeah. Totally get that. And when we as a panel were getting together in preparation for this, we kind of looked at it in a sense that diseases do not discriminate, but health outcomes do, and there's an impact to that. So there's one other layer to this that we wanted to make sure we covered off in this up front, and that was around the social and economic inequities and the impacts that those have to each one of these audiences as well when it comes to their health outcomes. So I'll go to Patrick on this one, where when we talked about the impact of the social and economic inequities too, and what effect that has on these communities and their healthcare.
Yeah, no, thank you, Eugene. And I think when we look at this list of economic factors, social and economic factors, the thing we have to really understand is the interrelation between each of them. So you can't look at any one of them and try to solve it without understanding its relation to others, right? Whether it's education or diet and food, access to healthcare, the systems that they're in, the neighborhood, the physical environment, the economic stability or instability. Every one of them is related. And when you hear the term systemic racism or systemic issues facing minority communities or communities of color, this is a really good example of what that systemic issue looks like, because you can try to focus on creating greater economic stability. But if you don't do that in the context of, creating better education systems for these populations, then you're not going to actually create an improvement. You can look at the dietary issues that we have, but at the end of the day, cheap food is less good for you. And understanding how to, budget effectively to buy food that is cheaper, but you can make into better meals, takes a level of education, understanding, and access to those foods and to fresh produce and things like that. When you think about the community and social context, what environment are people being, living in every day and seeing and being exposed to? Every one of these issues is so interrelated that oftentimes I think we talk about them as things that you can impact in a silo, and that's not the case. And that's really critical when we think about, the slide that Greg talked to earlier, and we look at health outcomes and health issues for communities of color. It's not just because they don't have access to healthcare. It's not just because of the food they eat. It's not just because of the economic instability they have and the stress in their lives. It's every one of them, and they're really connected. It's the systemic issues that they're facing, and it's impossible to untangle them from one another. And on the previous slide, you talked about, health disease does not discriminate, but health outcomes do. I think, Greg, you have a really good way of describing this, where you talk about it as, it doesn't discriminate, but it segregates.
Yeah, yes, Patrick, it's really important that, that point comes across. So while these diseases do not discriminate, they actually do segregate, because what happens is they go in and they really focus in on the weaknesses by each of these segments based on these experiences outside of just healthcare. These are experiences that are part of healthcare and lifestyle that creates a unique segregation. So if you think about what's happening in America right now, from the standpoint of the COVID-19 scenario, you now have an inordinate number of these people being frontline workers. So they're more exposed. They have to make a decision between, do I go to work or lose my job and find myself in an economic demise? And all those factors playing in together is a form of segregation also, because what's happened now is, while the disease can be caught by anyone, they're in very unique situations to be more likely to have those diseases, and that to itself is a form of segregation.
Thanks, Patrick and Greg. So as the title of this session denotes, we want to also give you hope. So we've talked a lot around the statistics. We've talked a lot around the different dynamics with each one of these groups, the pressures of socioeconomics and the impacts it have on outcomes. But we now want to give you hope in how we're going to solve that. So I actually have a question now. We'll go into the question sessions for the panels. And the first question has to do with, now that we've looked at these dynamics, what can a pharmaceutical manufacturer do to help lead change moving forward? So if we look at the current situation, what advice or what recommendations do you have for these manufacturers to help shift those health outcomes for any one of these groups? We'll start back with the Hispanic group. So I'll go to Rebecca and Henry to start with.
Yeah, so I think that the first thing that marketers can do is start a conversation. Just initiating that dialogue with Hispanics is really the first place to start. And we know that Hispanics are hungry for information. From studies that CMI has done, we saw that there was elevated interest among Hispanics in information, not just about COVID-19 right now, but in other diseases that they have. And it's because they're not always getting relevant information. And for Spanish dominant Hispanics, they're not always getting it in language. And then, of course, understanding the decision-making process and how cultural values might influence or shape that decision-making process. With that higher level of familism, a lot of Hispanics might look to extended family members either for their input or think about how their decisions are going to affect those additional people when they're making health decisions. So it's not about not only connecting with the specific patient, but also those other stakeholders. And so when you understand what that decision-making process looks like and what kinds of inputs that they might have that you might not already be considering, then you'll really create opportunities to increase compliance with medications and then improve their outcomes.
Awesome. Thanks, Rebecca. And then for the Black community, Greg, what do you think the pharma companies can do to help lead this?
So there's a really popular video on social media where a young man says, "Listen, Linda, listen." The first step in being successful with black patients and healthcare needs is this idea of listening to them. I can't tell you how many data points and how many times we see in reference the fact that Black people are not listened to for their ailments. They're not listened to and understood that there is something uniquely different or something taking place that's outside of the norm that you simply can't address by saying, this is how we traditionally do it. There are things that you can pick up generally, but you need to listen in detail to those things that they're saying is taking place to understand why those things are happening. I've heard from 3 different women who all had challenges that they went to 3 different doctors, and despite their socioeconomic status, I've heard this conversation with a Serena Williams who says that, in reality, doctors are not listening to me. And then I've heard it from corporate executives who said doctors are not listening to me. And then I've heard it from everyday people, frontline workers who are saying doctors are not listening to me. The most important thing you can do is to take a moment and to actually listen, not just have the conversation, but to listen to what they're saying, work on the norms around what they're saying to you, and then figure out what their solutions need to be directly based on that conversation and that listening. I think that's really important.
How does trust play a role in that listening too for the Black community?
And so you always, Black people are really amazing in terms of that diversity. A quick story on that. I asked someone one time, why do you keep removing the ends off the pot roast? And someone told me they do that because, it tastes better. But then I went back and I asked a really elderly Black woman, why do you remove the ends off the pot roast? She said, well, the reality was when we first started being able to have a pot roast, we didn't have a pan big enough to cook it in. So we had to take the ends off of it to cook it. If you think about that approach to things with Black people, that idea is that sometimes there are perceptions about things that are unfounded because they're simply driven by word of mouth and relationships, right? And the reality is those things are more trusted than the professionals. And so you've got to go in and establish that trust, because without it, you will never be able to achieve that understanding. And quite frankly, without understanding, you don't know what to look for. They don't know how to trust you. And as a result, it's usually a bad relationship.
Awesome. Thank you for that. And then for the Asian community, Iris.
Well, yeah, I totally agreed with Eugene and Rebecca and Greg on listening and also taking into consideration cultural values in this health decision making. However, I think for the Asian American segment, the circumstances are a little bit different. Some of the needs are actually rather basic. For example, 2/3 of Asian Americans are immigrants. They don't know how to navigate the healthcare system, so they need a lot of education on like basics like how the healthcare system works. And then another unique challenge is that there's a lack of data and on Asian Americans, not just specific to healthcare, just any industry, any market research reports. Usually Asian Americans are missing from the data set in the report, and when it's included, the studies are usually conducted in English. But when you think about, again, majority of them are immigrants, and immigrants from countries such as China, Korea, and Vietnam, where English is not their native language. So when you're conducting a study in English, the sample may not be representative of the segment. And then the third point I want to make is that there is a lack of subgroup data, because when Asian Americans are included in the study, everybody gets lumped into one big group called Asian American. But it is important to have subgroup data, because, for example, limited data research shows that Filipinos and South Asians, they have higher incidence rate of type 2 diabetes and heart disease than Caucasians, and which increase the risk of dying from COVID-19. So, if we don't have data, if we don't have subgroup data, we simply don't know, whether there's any problem, what the challenges are, then there's no way for us to come up with a solution to address it. So that's a long, winding way to say that we need to include Asian Americans in any research study, clinical studies, marketing research studies that you conduct. And if resources permit, have the questionnaire available in English, Chinese, Korean, and Vietnamese. Oh, Eugene, we cannot hear you.
Yeah, thanks, Iris. Yeah, no problem. You would think we would figure out how to use mute by now, right? Sorry about that, everybody. Thank you, Iris, for that. And you referenced COVID. So actually, our next question actually does bring up the pandemic. And I think you cannot have a conversation today about health without bringing up the pandemic. And predominantly here in terms of the fear of COVID and the likely significant implications on the future outcomes of health for any of these groups that might further the health inequities that we've already talked about. So does the panel have any advice for the healthcare and pharma companies in terms of how to shift that and apply some of the multicultural approaches that you just talked about in addressing some of this fear of COVID and not allowing the implications of future health inequities to continue? I think I'll go to Henry first now on this one.
Yeah, thanks, Eugene. So it's really interesting. The data that we've seen and the study that we conducted here at Zubi showed that, as Greg mentioned, with a lot of Hispanics working in the service sector, working in the grocery stores, and for example, that there was a fear of not contracting COVID for themselves, but there was a fear of bringing COVID home, possibly spreading it to parents and grandparents, and so that becomes an issue. And there's also this idea of putting off what would be routine healthcare. And we've seen that happen a lot among all populations. But I think that because of the aggravating factors that we've been talking about, it becomes more acute for these communities, particularly because of what Iris mentioned. You know, there's comorbidities that we know make COVID more dangerous. And in a lot of cases, those comorbidities like heart disease or diabetes with some of these groups are higher incidences. For Hispanics specifically, one of the interesting things we saw in our study had to do with mental health. Because Hispanics are very family oriented, they tend to have lower and different types of mental health issues, and family or relating with family is often one of the mechanisms with which Hispanics deal with stress. And COVID-19 strikes right at the heart of that, right? Where everybody's cocooning in their nuclear family homes. They're not spending time with that extended family. So it kind of is a double whammy for Hispanics. And so we would, think we need to start paying attention to how Hispanics cope with stress, and try to find ways to alleviate that and find ways to create family connections, so that without exposing anybody to COVID. But certainly, one of the things I worry about as a lot of geographies are beginning to lock down again is how many diabetes diagnoses we're going to miss, how many cancer diagnoses we're going to miss or be delayed. And those could have extreme negative health outcomes. And I don't know that necessarily policymakers are weighing those unseen costs, right, with what we see with the hospitalizations and the deaths related to COVID. Healthcare companies, I think, need to be really talking to their various constituencies and the various patient groups and explaining to them how they cannot miss these appointments and how they need to be taking care of themselves, and that not to take their eye off the bigger ball, which is overall health, when we're dealing with an acute situation like COVID-19.
Thanks, Henry. Unfortunately, I think the Black community is disproportionately impacted by COVID too. So, Greg, what advice do you have for folks here for addressing the Black community?
So, I think that to address the Black community, you have to go into a concept that's not even relative to this category. You have to talk about user experience, right? You have to talk about this UX idea of what actually is the experience that they perceive will be happening, and what is the actual experience that is happening. And you have to realize that all those things actually matter. It's not just simply someone's perception or someone having an old wives' tale. These are things that they're actually experiencing. They are working at a time when they have to work, but they can't be ensured that they're safe. They are providing services. They are losing their jobs at an inordinate rate. They don't know if they can go to a hospital safely for a diagnosis. They don't know if they can keep up their treatments. They got all these things happening at one time. The most important thing that a pharmaceutical company can do now is to take that time to intimately understand what those differences are and why. To create a dialogue around why these things are important, but to understand why there's a prohibitor to that relationship is really important, because these segments, Black people in particular, they're going through a time where there's a lot of uncertainty, right? And if I had to think about what we're going to see long term, that's going to be the biggest impact coming out of this crisis, as I called it earlier, it's going to be this concept of PTSD, right? Because nothing like this has ever happened before. We've never seen an economic downturn, a pandemic, and then on top of that, racial and social injustice happening at one time. And by the way, primarily happening all at one time to Black people who've not only had a disadvantage, but now have more things to have a disadvantage for. So it's going to come down to listening. It's going to come down to building out a user experience that is relative to the lifestyle that they're experiencing.
Awesome. Thanks, Greg. And then Iris, for the Asian community.
So when we were preparing for this webinar, and you show some of the CMI data, that 60% of Asian Americans said that they are putting off seeing the doctors, and which is higher among all groups. So I wonder how much, that has to do with the fact that a lot of Asian Americans, they face, discrimination, since the pandemic, the outbreak. And then also because of their experience with SARS, and also, the outbreak first started in Asia, so they were very, very cautious about contracting, the virus. And then, Asian Americans, they do face a number of health disparities, such as, TB, hepatitis B, diabetes, mental illness. So I think the situation will only make the situation worse, increase the health disparities. Specific to the Asian American community, I think in language communication is really important. Like I mentioned earlier, that they a lot of them, they simply, particularly those who do not speak English well, because 40% of, for example, Chinese, Korean, Vietnamese, they are not English proficient. Which prevent them from getting timely information on COVID-19 and care. So I would say in language communication, and also in Asian media, because research shows that in times of crisis, particularly those who do not speak fluent English, they tend to turn to in-language media, Asian media for information. And there's also higher trust in Asian media because they are, in a community.
Awesome, thank you. So we'll try to advance forward to make sure we have time for some questions. The next topic that we brought up when we were preparing for this was we're in the business of communications. So we actually see a unique opportunity where we can leverage that expertise in direct consumer or healthcare professional communications as a step forward to supporting a better health equity. So what could we do from improving the communications perspective to try to ultimately improve those outcomes for these groups, for the health outcomes for these groups? So I will go to Patrick first for this one.
So I think there's one thing that we're dancing around a little bit here as we're talking about, needing to understand these communities, the nuances, the challenges they face. Marketers have to decide and commit to the fact that this is foundational work that needs to be done in order to change health outcomes, right? So we're talking about the communities that are most impacted by healthcare issues. As healthcare professionals, our goal each day should be to show up and improve health outcomes. If we're not doing that, if we're not actively doing the groups that are most heavily impacted by healthcare issues, then we're not living up to the reason why we mostly show up to work each day. It takes my breath away that sometimes we get into these discussions and strategies get set, audiences get chosen, and 2, 3, 4 steps down the road, somebody says, well, you know what, we've got to consider this population or that population. That's not good enough. It's got to be foundational in what we're doing, in everything we're doing, if we're truly going to impact health outcomes with the communities that are most heavily affected. We can't pretend that that's really what we're trying to do when our emphasis is on communities or the general population, when we know there are higher at-risk groups that we need to think about. It can't be, let's bring in this group now that we've got kind of the base sorted. It's got to be foundational in everything we do. And I think it starts with the overt commitment from marketers, from the pharmaceutical industry to focus in that space.
So I'm going to do a second question on top of that then, Patrick, too. So how does somebody convince their organization should they not see the value in that?
Yeah. I think the data is overwhelming, right? This is where we know enough now. There are no questions. We've gone through it. We've seen the data. We know how big these audiences are. We know how big the impact is. And honestly, I think it's as simple as standing up and saying, look at the disproportionate impact this healthcare issue. And, quite honestly, it's almost all of them. It's not all of them. It's a little bit of an overstatement, but you'd be hard pressed to find a disease state, a healthcare issue that doesn't disproportionately impact a community. And these are large communities, the Hispanic community, the Black community. These aren't niche communities. We need to use the data we have to make the business case, to make the human case for why it should be foundational in what we do, not a bolt-on, not an add-on to the strategy that we create to address the needs of the general population.
Awesome. So we'll shift into a little bit of lightning round for the rest of the panel. So Henry, anything additional you want to say from a communications for the Hispanic community?
Yeah, so I would say start today. Would be the advice I would give. In relation to the group, to Hispanic, the analogy I use is, imagine you're throwing a party and you're having a conversation with some people at that party, but you're expecting everybody at the party to overhear that conversation. And that's not the way that it works, right? Like the host of the party has to get around and talk to the different people that are there if he wants to be heard. So I think you can't assume that Hispanics are going to necessarily hear your marketing messages, particularly when we have in our group a language divide among some of the people in our group. So I would say start today is ultimately the thing that you need to do. And related to your follow-up question about how to get stakeholders high up in organizations to buy in on it, I think a lot of brands are looking for growth. It's what you're doing your annual planning and you're saying, where are we going to get our incremental 2-3% growth? Well, there are audiences that you're probably not talking to that could yield you that 2 or 3% growth, which doesn't sound like a lot, but I'm sure that the brand managers out there who have mature brands would say, I'd kill for 2 or 3% growth. So start today.
Iris, for the Asian community for communications.
Just building on what Patrick and Henry said, so I give what I thought of, not necessarily specific to the Asian community, but more from a communication approach and campaign perspective. What came to mind is the census campaign, that, what they use is a bottom-up approach instead of top-down, because from the very beginning, all agencies, Asian, African-American, Hispanic, LGBT, and other, agencies for other segments, they all came together to talk about, creative approaches, and each agency was given a lot of room and flexibility to come up with the creatives that's relevant for their segment, compared to, a lot of times, or in the used to be that, it's one agency taking the charge and using a top-down approach that, the rest of the agencies would be translating, or what we call transcreate, one positioning statement. And when that creative idea was conceptualized based on one set of cultural values, sometimes it can be translated, sometimes, it simply doesn't work.
Awesome. So we actually have quite a few questions coming in, so keep them coming in. We'll shift to that right now, and let's go quickly. So I think, Greg, I'd like to ask you this question from the audience here. How does implicit bias factor into how we strategize and execute multicultural marketing?
Okay. So a couple things that we would recommend you consider is the following. I'm going to kind of go off script here for 1 second. So these solutions aren't going to be easy. So if you believe that you're going to solve this in a year, that's probably not going to happen. I always say to people, remember, it took, from a Black person's perspective, it took America 400 years to recognize that Black people have a challenge, right? So if you get this solved between 3 years and 400, you're doing good. But understand that the construct of what we're talking about is systemic change, which will impact implicit bias. Systemic change is 3 things. Recognize what role your company may have played in creating some of these biases, right? Things that you perceive to be true or untrue within your corporation. Look at your own hiring practices. Look at the people who make up your marketing department and make up your product development teams. The other thing is, look at how you're developing the products. If Black people are last, or people of color are last in the clinical testing and trials process, as opposed to being first, then you probably have some implicit bias unless you believe that that's a priority. I recently was exposed to something where sickle cell, which is rampant in the Black community, actually does not have any communication strategy for Black people. So think about that. It's a disease that's rampant in the Black community, but there's no communication strategy for Black people. And the last place is partnerships. you probably have to change even the people that you rely upon as first tier, second tier, third tier suppliers and help you develop better partnerships. And those partnerships should be more aligned with the people who are actually on the end result. So 3 things. What role have you played in implicit bias and how do you change that organization? The second part is, what are you actually doing with the products you're creating to be less biased against these segments and include them upfront? And last but not least, how important are your partnerships to you and where do you implement them in your overall strategy and go-to-market approach? Hopefully that answers that, Eugene.
Awesome. Maybe I'll actually also look at it from the Hispanic point of view too. So Rebecca, same question around the implicit bias from the Hispanic community perspective.
Yeah, so more than implicit bias, I think what's going on with the way that marketers are connecting with Hispanics is there's a fundamental misattribution error, meaning that we see data, we look at the numbers saying that Hispanics are less likely to be compliant, less likely to seek medical care, and instead of thinking that there's something situational going on, we believe that it's something inherent about the population, that this is the way that it must be, and this is just because they don't want to take these medications. And that's not necessarily the case. Often it's because they lack a usual source of care, or because we don't really understand what their decision-making process looks like, or we're just not speaking to them or communicating with them. So, understanding how you can connect with them, who you can connect with them through, while they might lack a usual source of care through a doctor's point of view, they may have a pharmacist that they rely on. And that's very common amongst especially foreign-born Hispanics who have a different relationship with pharmacists in Latin America than they do in the than people do generally in the United States. And so knowing who they can rely on, who they trust, how you can disseminate that information, and just understanding that a lot of these things are situational and that by starting those conversations, you can actually change those outcomes.
Awesome. Patrick, I can tell you're anxious to add on to this. I can sense it over this video.
No. I mean, I think there's a couple other questions that have come in that I think are very interesting as well. But I mean, implicit bias in the issue of it, I think first thing and foremost, again, I go back to foundational issues. We got to make people recognize that they have implicit bias. So I would just, continually push us back to the foundational issues that are keeping us from engaging in these discussions. And one of the biggest ones I've encountered with my teams and the teams I lead and the clients that I work with is the lack of recognition that implicit bias even exists. So much work needs to be done to make people aware of it and understand that it's not bad. It's only bad if you ignore it or aren't willing to confront it. That's what's bad. Everyone has implicit bias, and we need to learn about it, understand it, and use it to make things better. So I would, defer to the experts in their communities like, Rebecca and Greg on how to change that. But first and foremost, we've got to recognize it exists, because that doesn't happen all the time.
Awesome. So yeah, there was another question that came in too. I think for you, Patrick, actually, is how do we keep these important factors included in the high-level discussions that impact foundational planning and resource decisions.
Yeah, there's a couple questions that have come in around this and making sure that how do we keep this, how do we convince stakeholders? How do we keep it in the discussion? How do we keep people focused on it, on the benefits of it? I'll tell a very brief story because I know we're running out of time. I was on a flight back from somewhere, I think Dubai or somewhere, and I was sitting next to somebody who wouldn't shut up. And we were having a conversation about a topic, and his knowledge and passion for it were so great, I couldn't leave the plane without being fully on board with it. This is a hard topic to win with. If it weren't hard, we wouldn't be having this panel. And I think, my advice to other marketers and agency folks and teams is, again, go back to the data. Understand it, look at where the impact is with healthcare issues, and focus on the potential we have to change those outcomes, right? The greatest impact is going to come where there's the greatest problem. The data is available to us now in ways that it's never been before to understand it, to measure our activities, and to celebrate successes. So, I think the answer to those questions is around, again, get smart about it, believe in it, find small successes that you can celebrate and bring up. There's not a manager out there in any company right now that's not going to want to celebrate and champion successes in diverse communities, in underserved communities, because it's where we can have the most impact. So my advice is get smart, be passionate, be committed, and be tireless about it. You will have a bigger impact on people's health, and you will be respected for it. I can't imagine there will be managers, there will be leaders, there will be stakeholders that don't support this.
Change takes effort. Absolutely.
And I think Greg would like to jump in here. I think.
Yeah. So Patrick and I recently had a thing we're working on. I got to tell you, I have to reemphasize what Patrick is saying. This is not easy. So these are tough conversations, and people who get passionate about it won't let you get off the plane. And people who are completely fearful of it will actually show you a way off the plane faster than you can imagine. And so what I say to you is the following to consider with this. It's hard for companies to hear that they may not be doing the right thing, but it's a conversation you need to have. Patrick and I worked on something recently where the company was extremely inclusive, but was not diverse. And it was a 100-year-old company. We had to say to them, you are extremely inclusive, but not diverse. And when that data point came up and they realized that reality, the conversation shifted immediately. But to Patrick's point, these are very heartfelt, very stringent, very straightforward conversations that you have to have. And until you unearth those truths, you will never be able to solve for this. So just please consider that.
Awesome. We are running short on time. We had one other question come in, I think from a hope point of view and a health outcome I think we're all desiring is how we're going to overcome this pandemic. So the question that came in is, now that a vaccine is on the horizon, how do you best suggest disseminating and encouraging each group to get vaccinated? So we are going to go quickly through here. We'll start with Iris, and then I'll go to Rebecca, and then Greg.
Yeah, I would just reemphasize the importance of in-language communication in Asian media, because you can probably get the English-speaking Asian American general market communication. So it's the in-language part that is missing that you can help fill the gap.
Awesome, Rebecca.
Yeah, I think for the same with Hispanic, there's a language issue. And a media tactic issue, knowing how to reach them and where they are.
And Greg.
And with Black people, the major issue is knowing where to reach them. So a general market buy is never going to be enough now, especially in areas where you need to gain their trust. You need to understand what those endemic sites are for them, endemic locations are for them to make a relevant connection.
Amazing. So thank you to the panel, Iris, Rebecca, Henry, Greg, Patrick. Again, I got the easy job of just asking the questions and triaging the questions. You guys are amazing. Thank you so much. And with that, I think we're just about at time. I'm going to pass it back to Susan so that we can close this session.
Thank you, Eugene. Thank you, Rec Philly, for making this event happen. Thank you to our panelists. And most importantly, thank you for all of you who've attended today. We know that this is an important topic, and we really appreciate you embracing it. I personally have learned a lot today. And as we conclude this panel, we do hope that it prompts each of us, especially those in healthcare, to take action. We're living through probably the worst pandemic of our time that we will ever see. Hopefully there will be nothing as bad as this in the upcoming years. And there has never been a more important time for a heightened minority focus and change. And we can and we must do better. Now we're seeing more and more medical students modify the Hippocratic Oath to include their stance on diversity, on equity, on inclusion. And you know what? We must define our own Hippocratic Oath and action plan towards racial health literacy, intelligence, equity, and justice for all. We at WPP welcome the opportunity to answer more questions. We did see some questions coming in, so we will do our best to not only respond to them, but post them for everyone to see. If you would like to ask more questions or want more information, or are interested in bringing our team over for an internal working session on helping you build out your plan and answer some of these key questions that you have, please reach out. You can reach out to marketing@cmicompass.com, and we will be sure to funnel the questions to each of the panelists as well as the broader team and absolutely get back in touch. Thank you again, and have a meaningful rest of your day.